Welcome back to San Antonio Living. Help, I've got droopy eyes. That is our topic that we're chatting with Dr. Manny Lopez this morning. And I'm not even joking. It's good to see you, by the way.
Good to see you.
I did wake up one day and I was like, man, I look tired. And so it was time for Botox. I mean, everyone hits that point. I'm real sorry. But you know what? It sure helped a lot.
Yeah.
And my eyes are awake because I think I was having a hard time reading and seeing because my eyes were so droopy. But you know, everybody hits that point whether you want to do the Botox or not. You know, your face changes over time.
Right. Every procedure that I do is meant to highlight the eyes. Whether I'm fixing a nose, whether I'm doing protruding ears, whether it's I'm fixing the neck. It's to highlight the eyes, which is really where the beauty lies in the face.
And that's where people are drawn to. You know, that's the first thing you see. So this morning we're going to talk about how to fix that, whether you're my age, whether you're my mom's age or my grandma's age or whatever. And so the first place to start is with non-surgical. And what is this little, it's like a space age thing here.
This is actually the Clarisonic Opal. It's pretty cool. It's a infusion therapy. It's new to the market. And what you do is you put this anti-aging serum on the opal. And it's twice-a-day treatment, and it's really cool. It just gives you a little vibration.
And it's like that. If you use the Clarisonic scrubby thing on your face, same idea, but it's real small for the under eye area, which
under eye area, which is an area that is tough to treat often surgically, or even with Botox, because you don't want the eyelid to pull away. So it's a nice adjunct to your retin-A that you should be doing every night, right? It's a nice adjunct to the Botox that you should be doing every 3 to 4 months. And it gets rid of that puffiness or improves that puffiness in fine lines.
So that is the Clarisonic, and we'll talk more about that a little bit later on. Let's talk about Botox, because that's the next step for people. And a lot of people might not be sure what to use the Botox for. Like, I didn't know that it could help fix your droopy eyes, but it can act, just by lifting your forehead, it fixes all that problems.
Right, so what Botox does is it prevents muscles from contracting. So as you can see in these pictures, this woman has a scowl with those lines, and ultimately over time, she has an angry look, a tired look, and those lines from the repeated muscle movement will end up forming and not go away. And so with Botox, you prevent those muscles from contracting, and then you get a nice, smooth appearance.
It looks really good. It's easy. You do it every 3 to 4 months. And if you just keep doing that for the rest of your life, I think you're going to be okay.
You're going to be fantastic. And you also get brow lifting, like you mentioned, by knocking out the muscles that pull down the brow. So it just gives you a rejuvenated look. Easy 2-minute procedure in the office kind of thing, and you have no restrictions afterwards.
The next step is talking about doing some eye surgery, and I have had friends who have already had this done, even some men who have had it done. Everybody does it for different reasons, but where do you do, say, the lower eyelid? Let's talk about that. How do you fix, oh, that's an amazing difference.
Right, so here, obviously, the picture on the left, you see a face that is somewhat tired appearing, not well rested, and what that is it's just the fat in the lower eyelids that's protruding forward. So that cannot be treated with creams or lotions and potions or even Botox. That is a surgical treatment, and what you can do is if you can little incision under the eyelid margin and get significant improvements, such as this one as well. This one has less puffiness of the lower eyelids, but by removing that lower eyelid and doing a little bit of skin tightening, you can get a dramatic improvement.
And how long will something like that last?
That's forever.
Forever.
Once you've taken that fat out, it's not coming back. It's not a weight-dependent fat. It's a fat that essentially is there to allow
there.
Yeah, it's just there.
We won't put it somewhere else, that's for sure.
Get rid of it.
So we talked about the lower. What about people who have saggy eyelids? What do we do about that?
Right, so over time, we get this laxity of our upper eyelids that we can just remove the skin and do a little muscle tightening and get a dramatic improvement. This can actually help your reading, your watching television, your driving as well. So there's a functional component to this as well. So you can see in the picture on the left.
You get like hoods, eyelid hoods.
It's like, exactly, like little blinders. So you just take them away and there you can see the eyelids again. So quick in-office, both of these are in-office procedures.
Really? Easy.
Correct.
Easy stuff. Okay, and what about, there's a procedure too, upper and lower, that you can do that's non-surgical.
Well, you can do non-surgical, but for instance, this one here is actually, he had his uppers and lowers, so this is just showing the fact that men do have this operation. They do get the laxity as well and the puffiness, and you can get dramatic results without getting that plastic look, right? Without getting that appearance of, oh my gosh,
wow, that's
she's
a
had
big
surgery,
difference.
right?
What's that?
So same thing, upper lids and lower lids. It's a nice combination to open up the eyes.
Look how close, I mean, seriously, that's how I felt the other day when I woke up one morning. I was like, good God, I need to get some sleep or some Botox.
Right.
So I went with the Botox.
There you go. And here's where you're talking about the non-surgical. This is a patient that actually just had her upper eyelids done.
Okay.
The lower eyelids with what we've been talking about with the Retin-A, with with Botox, and with occasional peels, you can get significant improvement. That's a non-surgical result on the lower lids.
That's pretty amazing that there's so many different options out there for people. And the best advice that I can give you is, you know, just get in with somebody who knows their stuff and start taking care of your face. Whether you're going to use something like the Clarisonic under eyes, you know, you're going to use facials, whatever. Just get with someone who you respect, who you trust, because you're going to be together for the rest of your life, pretty much.
Exactly.
And you've got a special deal for our San Antonio Living viewers with this Clarisonic Opal. You're going to do 10% off?
10% off. You mentioned SA Living, and we'll give you 10% off.
Very good, guys. Let me tell you who to get a hold of. You can find Dr. Lopez here in San Antonio. He is up in the Stone Oak area off of Santero Boulevard. You can find out a little bit more about him and what he does at lopezplasticsurgery.com, or give him a call and set up a consultation at 495-5771.